to also take part in our next meeting this Friday, June the 25th at 5 p.m. Brazil time, in which we will debate the economy and we'll have Eduardo Suplicy, professor, economist, former senator, and current councillor for the city of São Paulo, Débora Ferreira, professor and researcher at CEDAPLAR, Federal University of Minas Gerais, and the panel will be moderated by Daniel Duque. He holds an MA in Economic Sciences from the Federal University of Rio. I would like to thank the panelists and moderators who voluntarily participate in the debate and make this event possible. Now, I give the floor to our moderator, Flavia Ferrari. Good morning to everyone and good afternoon to everyone who is in France. Those who are watching live now, my name is Flavia Ferrari. I have a bachelor degree in biology. I am part of the team of the COVID19br Observatory, an independent initiative. And I founded the movement called Todos pelas Vacinas, meaning all for vaccines. Today, I am here to mediate this debate, and I'm going to introduce you our guests. Alexandre Padilha is a doctor, university professor. He's also a federal representative. We also have Luiza Helena Trajano. She's the chairman of the board of Magazine Luiza and president of the group Women of Brazil. And we also have Ester Sabino. She is a professor. She's responsible for the sequencing of the COVID genome. Now I'm starting. And then the idea is that we are going to have a general question. So I'll ask you to reply to this question in the order of presentation. And the question that I have for you is in regard to the COVID-19 pandemics. We know that we don't have only one solution for the problem. And it all comes into, it happens into with a context of a lot of inequality. The pandemics does not reach everyone, and the vaccination is an important part of the solution, but this is not the only solution that we have. What other actions should be taken into account so that we can mitigate this scenario of more than 500,000 casualties and deaths to decrease the death in the pandemic situation in Brazil? I start with Alexandre Padilha, please. Hi, Flavia. Good morning, good afternoon, or good evening, wherever you are watching us now from, whether you are live and everyone is at different places. I'm very happy for this invitation, happy to share the floor with Luiza Trajano, Ester Sabino. I studied infectology at USP, and I learned to carry out the PCR testing at the medicine school at USP. And I am proud to say that, first of all, we use a concept, and this came from the fight against AIDS. It's not about pandemics, but also about endemics. It's not a single sanitation event. It does not impact health alone. The fight against AIDS and the pandemics we had with AIDS in the 20th century, the idea is that the pandemics is a sanitary event. In case of the COVID-19, it impacts health as a whole. And it's not just about the deaths that we have, more than 500,000. We had a tremendous number of people who were affected and they still have their side effects impacting their lives. I see some students and people who in the front line taking care of patients who are presenting side effects. We are going beyond our capacity, but it's not just a sanitary event. There are economical, social, and cultural impacts and political impacts in case of Brazil, the way everything is organized within our society. And one of the most important and stronger impacts in Brazil is that on one side, it is just open this wound that we already had of inequalities, and it brings more evidence regarding the inequalities in Brazil. And it also intensifies the inequalities in Brazil and all of this disparity. Brazil is probably the most unequal country during the pandemic, because this has been perceived during the pandemics. The number of deaths, the access to vaccination, the mortality rate in comparison to public and health hospitals. The pandemics has deepened the problem. Some of the decisive questions that we have, and I think they are important to overcome the pandemics and its effects. First, it is in the health field, a central question, the strengthening of the unified health system and the primary health care. One of the strategies that we have for the reduction of inequality to access to health in Brazil was the creation of the family health program and the strategy that encompasses it, and the basic attention program when I was acting as a minister of health in 2011, and then the program we called More Doctors, Mais Médicos. This was already interrupted in 2019. If we had that in place during the pandemic, we'd have a lot of capillarity in our network to help people, and we'd be more present in more vulnerable areas further on in the future. So it would be decisive in order to mitigate the problem, to identify immunization needs in outer skirts in more distant areas. So 1 year before the pandemics, in 2019, the IBGE data showed there was a reduction. If you look at 2003, all of the domiciles, half of them would receive a visitation from a family health doctor. In 2019, it dropped down to less than half of it. People would receive health care in around 2003. And in 2019, it would be only 38%. So from 90% to 38%, the drop is tremendous. And this is a decision of government of Bolsonaro as president, and disregarding all of the campaigns concerning immunization. Since 2000, it is the first time that we do not reach the immunization target that we had for children. This has been a dismantling of this program, especially now that the pandemic situation. And now with the pandemics, the federal government has not made any special concrete offer to take care of these people. It took more than a year for them to move and do something, to ensure protection for professionals to act in partnership with cities. When you look at all the resources, well, we had approved at the House of Representatives before the distribution of resources before, and most of this money is directed now to other initiatives than the basic attention that we need to provide to the citizens. So this is all about strengthening the primary health in Brazil. We need to increase its coverage. We have it decreased the coverage from 50 to 30%, according to the research into 2019. We need to reach 80% in order to have it effective. We need to work for 6 years in order to achieve that number, to improve the family health in our country. And of course, that's not the only policy that needs to be taken care of. We need to work on employment, hygiene, and it's just so important that we have Luiza Helena Trajano here as an entrepreneur that involves women in the process. They are the ones that are more affected than anyone else. They are the one who has lost income. They are suffering domestic violence. So the need to have policies that really involve this strategy and situation. The health family is not the main tool, but of course, with other other fronts, they are going to be tackled all together. But this is going to be important to help the most remote regions to try to change this unequal situation. Brazil is still in the center of the pandemics. We are still having a lot of deaths, close to 500,000, and the immunization plan is running very slowly. And to overcome this, this primary health care is of utmost importance. In São Paulo, the São Paulo city, for example, the neighborhoods in where people die the most are the ones who are less provided with assistance. They are the ones who need this primary healthcare assistance. This is how we find out who has the comorbidities, and who are going to need the primary attention before anyone else. This is what we need so that we can have this program to move forward. We need to recover this. From the health perspective, Flavia, I think that the main access to fight inequality is the strengthening of primary health care. We need to recover this. We need this plan to be strengthened again. Thank you, Alexandre. Yes. And training of such agents, and Gabriela Lota has carried out a research on this that shows how weak this training is now, because they are the ones who are going to be in people's homes. So the role of these people is essential in the fight against a pandemic or a syndemic, and so that we are going to be able to tackle all the other diseases that we shouldn't be suffering from, but we are still suffering now from them. So with Luiza Helena Trajano now on the floor, apart from these immunization and fighting fake news, and this is something that you do, what else can we do to not remain in this high level, a high number of deaths in this country? Well, thank you, Flavia. I am following the youngsters who are working with this conference, and they are doing just so well. So I would like to congratulate you on this.
Dr. Alexandre and Dr. Ester, we are always working together on that. And thank you, Flavia, for this. As Alexandre said, social inequalities have been brought to the front of our attention. And one of the things that makes us very sad on that, I still wake up every morning thinking I'm having a nightmare. The pandemics highlights our impotency and all our inadequacies. I work a lot, and I think it's the first time many of entrepreneurs and business people realize that inequality are a responsibility of everybody. We have many places where we still have situations that are similar to slavery. And I also know many people who were not aware of the inequality. And I asked them, didn't you ever do anything? I think you got used to the roles of colonizer and colonized people, because there was a long history of difficulty for Brazilians to becoming protagonists in their own country. And entrepreneurs and families have donated over 6 million to help in the pandemics. They, not only because of the money, because they all started working. We want to donate to respirators, to ICU units. There is not one single family among the entrepreneurs who did not donate at least 25% in terms of basic food staples, because hunger has also increased a lot during the pandemics. And now I think they at least are attend to the fact that they need to share the responsibility for social situations. And but I also think that there's a great degree of unemployment, and that's how we get to the issue of the vaccine, which is very important. Another thing that Dr. Ester is going to mention, in which Women of Brazil group has been involved, regards the research and anticipation to these situations. She can talk more about that. She is a fighter because what's been happening in technology and science with us, we cannot let that happen again. We need to work to recover that, to bring back scientists who are out of the country. I talked a little bit about vaccine in France. Also, people have medical situations and all that. And here in Brazil, we have a very strong project that is the vaccine for the family, because we have been working in the slums. Uh, uh, Publicity is very important. We have to use the language that they use, talk the way they talk. Our movement has 3 different agencies to adapt the language, because they have many fears, like the one of there is a chip in the vaccine that's going to affect your life. And so we have many other difficulties, and we need to control this publicity in both directions, because sometimes you announce that there's going to be a vaccine and the vaccine doesn't come. So we have to be attentive to all that. Our group, Women of Brazil, is creating an institute. We're working very hard. We have many actions. United for Vaccine has also proving that, and we are trying to fight to save lives and generate employment. It's a very sad situation, as Deputy Alexander said. Women have suffered a lot, but on the other hand, the situation has shown how strong women are. There are a lot of companies, and we are focused very much on that, on giving employment to women and Black people. So 2 years ago, I started talking about that, and some people were very angry at me, all that. And I come out to talk very often to talk about the Black people and women. We have a society for 10 years, and those responsible put me as with another colleague as a president. I thought they were going to say, we're going to change, I'm going to send something new. And he said, we're exchanging because we are making big management changes. We have 5 or 6 women in very top positions. And we're talking about a very important bank. Another thing that is very important, and our group works a lot, is violence against women. This happens everywhere. We see that in all countries. And women in Brazil focused on that very much. We can talk about education, and that's very specific. But when you talk about violence against women, we see that everywhere, in England, in France, in Brazil. And the pandemic has also brought to light the strength of women. And another reason for that is now we have the participation of the financial market. We have been talking about investments, talking about changing the purpose, talking about women, talking about Black. I never dreamed, I always fought for that, but I never dreamed I would be able to see changes. And when the financial market joins the fight, things tend to move faster, but we still have a long way to go. The situation is very serious. Every time I see Deputy Alexandre, I apologize for him because he's one of the ones who fight for Eduardo Suplicy was one of those who fought for minimum uh, wages all the time. He'll be with you in the future, in the next panels. He understands a lot about that. He was one of the people who talk about that all the time. He's been talking about that for 10 years. If you don't have a basic income, there's no way to talk about fighting hunger. I've always heard about that, and but the law that defines, or when you talk about basic income, we should name this project Eduardo Suplicy, because he says we cannot come out of hunger if you don't have a basic income. And it's very interesting because people consider me a right wing or left wing, depending on what I say, because I defend different things. But when we're talking about basic income, this is something I really fight for. I just want to conclude that we started talking about the unified health system, SUS, a long time ago since we started. This is very important. We don't have to change anything about that. We just have to make it work. So I want again to congratulate all of you for this event, and for also bringing Eduardo Suplicy, because if you're going to talk about basic income, he's the guy, the person to be talking about that. You talked a little bit about gender. In my area, I'm very much involved in science publicity. We have a couple of boys and we have a lot of women. And I think it's very interesting. When you talk about science, we're going to talk about that a little bit more. This is an issue that has been embraced by many different groups. We have a very interesting partnership with fans of music like K-pop, and this is a fantastic way of collecting food staples. We get a lot of young people together talking about science, and it's because of them that this got to the first to place in trending topics. So the society has been taking over some of these subjects. We have to think of scientific methods for everybody, make this coffee time conversation something very basic and common to talk about, and how women are important in all this process. So again, I'm going to ask the same question to Professor Ester, who along with another woman was responsible for the sequencing of the genome for the COVID-19, and she works with another woman, and she's going to talk also about how you prepare so we don't suffer as much in another pandemic in the future, which we are sure to have. So how can we do to fight this syndemic, as Alexandre said? It's a pleasure to be here with Alexandre, such one of our famous students. And it's great to see so much inspiration. The first thing I want to talk about is, what do we do? If I were to say something, what really caught my attention was the lack of coordination from the government. It would be very hard to begin the beginning to fight against a pandemic in the situation we have in Brazil, but it's impossible to conduct an orchestra without a conductor. And it's very hard because measures change in time. And if the measure you apply is too late for the time you're in, it will cause damages instead of helping. So we need organization in all that. So it's very hard to say what to do now at this time. Certainly, Alexandre said something very important. Without an active primary assistance in health, we can't do anything. If we manage to reduce the number of cases, vaccines are not 100% active, the virus will continue replicating. We need to detect cases as fast as possible. We need to be able to detect any strain that escapes the vaccine and be able to block areas or actively go after people who have been infected with this specific strain. And without this specific view, we cannot deal with the new problems we have to face in the future. So this is the first main issue. First of all, coordination. Without coordination, we won't be able to live off that. Even with vaccines, the virus will continue to replicate in a smaller rhythm, but will continue. So any new strains that come up, like the one in Manaus, it came up very quickly, spread very quickly, and that can happen, and we have to be very attentive to that. With regards to research, we need a research program focused on the improvement of our unified health system in a science that is coordinated with the public power. Whether it's councils with scientists, where you know who are the scientists who are going to be participating, who will be called. And this understanding has to be part of our routine for all activities related to health, to make more clear the definition of all this. I saw this, we have these groups, people who are elected and stay there for 2 years, supporting the decisions of FIG and all that. You know who are named because this is open. So one thing that we should have in all the levels of our legislative branch is to know who are the scientists who are going to participate in the group, so that the government can also participate and to say, with this one, we're going to define actions with the support of this group. So maybe you should think of structure. Even we can have a more knowledge and see the potential of all these scientists' works. We are living at a time where the population has just started to understand what science does, and we cannot let that pass, let that go. As you said, it's important for science to become a day conversation topic for people, as much as soccer is. I always wonder why people spend so much talk debating about soccer, and that's very hard for me to understand, but maybe it might be hard for them to understand how important it is to talk about science. And that's what we need. Bring that conversation to people. That would be just fantastic. I think that's basically what I wanted to say now.
Yes, I understand. Yes, I do fight for this science of coffee. Remove this from this ivory tower where only researchers and professors discuss this kind of topic. I want people to discuss these topics as well. So this is when all these miracle treatments start gaining force in conversations. So they need to understand what thinking of science is all about. So just to use what you said, and I'm going to ask another question to Luiza Helena. You've mentioned surveillance, you've mentioned research, and how to think of the next pandemics. And there is a study with Marcia Castro regarding the forthcoming pandemics and possible treatments. So we could consider this as well. And also the relationship with the private sector. There are some initiatives regarding scientific disclosure and research. How can we mention and support this? Is there a public bidding for this? People who would like to carry out this kind of partnership, do they just start that and start working with that, or they just need to collect money from other organizations to make it happen? How does the private sector and other entrepreneurs, how can they organize to finance science, and how can they make sure that they are financing quality science? How would this work from now on, of course? What we are considering, and but right now we are really focused on bringing the immunization to everyone. We are working on the side, trying to have to put a panel together with doctors and researchers and science institutions. So the first thing that I am asking, I'm going to create a group, is let's just collect information on everything that we have in Brazil. Everything that we can collect will help us not repeating or doing a rework on anything. Because if you do not have a, a panorama of what we have in Brazil, this is not going to work. I used to participate in a science institution with Davi, and he has a short-term, mid-term, and long-term strategy. You don't need to reinvent the wheel. You need to use ideas that are out there already. The private sector will help one side, won't necessarily help another side, but we need research on what to tackle first. We need to find out what is happening in Brazil first, so that we can distribute the money and allocate the money better. So I think it is important, and I was participating with Osvaldo Cruz, but it's been for 3 years now. But I am with the Institute of Science, and I heard them talking about this planning. There is a way to organize. There is a way to do it. I've seen plans before, and it's going to help us on how to get there. This is what I am doing. If there is one plan that is good, let's try to help this one to get developed. But I really don't think on the continuity of this, because the civil society is really mobilized. But if we do not have a plan, a strategic plan for science, this is not going to work. For Brazil, my dream, and uh, I've translated Japan 2015 and translated into something for Brazil. Let's plan on housing, employment, everything for the women. We want this to be in the word of mouth with people. We want people to talk about this, just the way we've worked with United for vaccines. No one was against our work. We did our research. We've reached more than 5,000 municipalities with this, with the Secretary of Health. Whether it's large or small, we are there with them. All programs have one of the women that work with us included in that program. And this is a passion for vaccine. It is just so beautiful, because sometimes they don't have Wi-Fi, they don't have a computer, most of them don't have the resources, but still. And when we see that there are not enough numbers on some of the city, it is just that people do not have the resources, not even to input all the data in system, to feed system with everything that we are doing. We are just a startup, so we are starting to work, but sometimes we don't have the resources. When Alexandre Padilha was the minister, he was very aware of that, and I am showing the unknown person that carries out a lot of work for science and for health, and they do not have the spotlight on them, but the work is happening. Um, There is a way on, we need to show people what we are doing, how we are going to get there, and what the main objectives are. We are working with Ester. She's here with her. We are working with some of her research, and this is what we need to know. We need to know what is happening in Brazil. Let's use this moment for this. It's a moment in which science is at stake, and this is the correct moment. I thought we were going to tackle education instead, helping with with the teachers and their conditions of work, but instead of that, we had to tackle the unified health system instead because of the pandemics. We were studying the unified health system in Brazil, but we had to trade priorities. But we have to do this together. We are heading towards a pathway with one line of thought. Esther was talking about variants, and it's important to have a network, and let's have this traced very quickly. We know that the virus suffers mutation. The longer it takes for us, the easier it's going to be for the virus to mutate again and again. So yes. So every time we find a new variant, we need to find out whether it's more transmissible or not and how it works. So we need a network to help with us with this. We need to look at this sequencing to find out whether it's a new variant or not. Sometimes people think that the vaccination is just about sending the vaccine and giving that shot. We need to plan immunization. We need to have a chain, a network that is going to work with the cities and the municipalities. We need logistics, especially now that we have an immunization with 1 or 2 doses. My question is now the following: how does this coordination happen? It's good for people to understand how the unified health system works and what needs to be improved. For example, for Esther, the question is about the genomic surveillance. Would it be a partnership of public and private sectors? Or what has to happen in order for us to help with this partnership and the surveillance? Can we prepare the unified health system to perform a very good genomic surveillance? So I'd like Esther to elaborate on this. Yes. National level coordination would be what I say ideal. We need to include all these groups. There are 2 networks in Brazil today that can help with the integration of people. So I think it's crucial. We'd like to make it happen. So during the pandemics, we need to look at all the sides and see all the strengths that we have. In case of the city of São Paulo, there was this demand, and there is a union between agencies, FAPESP is included, but we need to look at these potentials. I agree with Luiza. It's not easy, Luiza, when we carry out these studies, how to define science and what is the priority. You are going to see that we are going to have very hard discussions, and the solution is not simple. It's hard to choose how to distribute the money. It's hard to make that decision. We need to look at whether the person is producing something that you've idealized when you have the money in your hand. So I think one important project that we have, and the private sector was not used to financing the health sector in Brazil. So there are some models that we could follow. The Gates Foundation does that very well. It's something that we have to consider very carefully to define our priorities. But it's something that we are learning, and I am happy that this mindset is changing. More visibility to this. We are receiving resources from Todos pela Saúde, and there are some researchers that have been very important. And now with Luiza Helena, more questions can be tackled, but it's important to find out how this is going to happen and how the infrastructure to do this is going to be, so that we can carry out this for a longer time. And then we will avoid listening to something less, oh, science doesn't work, science is not enough, or we need to open people's minds and explain it to them. We need a cohesive group so that we can gather more funds for research. Perfect, Esther. Yes, we are in a situation in which we cannot wait. We should not try to reinvent the wheel now. Let's do what we can do with what we have. With genomic surveillance, for example, you need a number of laboratories. They need to receive the material very fast, and so that we can take a look at everything and understand what's happening with the pandemics. Um, the contamination is still really high. So there's this concern with immunization.
Brazil has also always been known as being a champion for vaccination. For H1N1, we vaccinated over 1 million people per day. And what do we need to improve in this network? If we had a vaccine, could we do that again? Does SUS still have this structure to vaccinate over 1 million people per year? Before I start, Flavia, I want to mention something about what you said about this genomic surveillance network. I don't think you need to have this contraposition. Would SUS handle that again? We don't have to have this opposition between public-private participation in SUS. Part of what DASA does is they have a contract with SUS. If you take the municipal health system of the city of São Paulo, I was a secretary during this contract. It's a huge one with DASA that leads it to have a huge scale. So in the health area and in Brazil, there's nothing that can have the scale we need without the participation of SUS. A private public partnership might be very important to think of organization, planning, but to gain scale, it gains scale when it works with SUS. As Luiza said, when you create a unit, you take advantage of the professional in SUS to be able to reach these 5,000 cities, for example. We don't have to have this opposition, in my opinion. So what Ester says is we need a level of coordination that allows us to take most advantage of the potential of the structure of this unified health system that is SUS. It works most of the time with structures that are not very well structured. Many of the hospitalizations done through SUS are done through partnerships with either public or private hospitals. 70%, 75% of the population in Brazil only receive health assistance from SUS, and the other 25% depend on SUS for more complex treatments, such as treatment for cancer, not even mentioning the ambulance assistance or service that is provided by SUS. So we have a huge potential and a great challenge that has been presented by the pandemics is to increase our capacity to produce inputs and medicine. And here I start talking about vaccines. Brazil has a huge potential. We had everything to be able to repeat the performance we had for H1N1 with public vaccination. It's true that when the pandemics arose, we were at the more fragile stage, the most fragile state of SUS. In 2019 was the first year we didn't reach the goal for child vaccination. Many of the campaigns were interrupted, But in a scenario such as the pandemics one, as uh, Luiza mentioned, the passion for people, or the search of people for vaccines, it's at its most. Many people forgot to get vaccinated by H1N1 or for tetanus, which is something you have to take every 10 years. But everybody is eagerly waiting for the COVID-19 vaccine. If the government had not refused the offer of 700 million doses from Pfizer, from Butantan initially, which was initially 160 million doses, each had been the agreement had been signed at the time it was offered. All the who offered a huge number Baxter, Moderna, many of the producers of vaccines offered vaccines for Brazil because they all wanted to bring vaccines to Brazil in 2020 for two reasons. First of all, for a history of vaccination programs. Bringing the vaccine, having it approved by Anvisa, putting it into Brazilian calendar, that has always been our flagship for the World Health Organization in face of other medium income countries. The second reason was that everybody wanted to evaluate the vaccine here in Brazil because we were at the center of the pandemics. If you test it in a place like this, you can more quickly evaluate the effect of your vaccine. So everybody wanted to bring their vaccines here, not only for selling like Pfizer, Johnson, Moderna, but also in partnerships to develop and test the vaccine, and also partnerships for transferring technology. If our government had been more active on this, we would have received more offers for technology transfer. So, and for everything, they would need the partnership of SUS. And even at its fragility, the SUS is well prepared to act in that area because we have this capillarity. In France, for example, you need a prescription. You then have to normally, traditionally, you would have to need a prescription, go to a doctor, or to then be able to get a vaccine. And they don't have a capillary network for vaccinations. So there they had to send the vaccines to hospitals, so the hospitals would call people and try to set up this network. We started way back in the 80s. We vaccinated up to 20 million children in a single day. As you said, in H1N1, I was the ministry for the government. We vaccinated over 1 million people per day. So Brazil has all the structure for this. I used to play with, say to Luiza, we had a goal for August. We had every structure to get to August this year to have over 170 million people vaccinated. If they had started with the vaccination plan in December, and we could have done that, the United Kingdom started in December and other countries. If we had accepted the vaccines that had been offered to Brazil, we would have been able to reach August this year with over 170 million people vaccinated, with all population above 18, including pregnant women vaccinated at that time. So I think our effort has to be in the sense of speeding up this process. One of the reasons is the debate on the priority groups. We need to include some groups that when they are vaccinated will protect more people. For example, women who are breastfeeding. I've been fighting for that. We need to vaccinate women who are breastfeeding their children, because you have one vaccine protecting two lives. Sometimes you have a mother who will breastfeed more than one kid, either because they have twins or because they share their milk with other kids. So we have to accelerate vaccination in groups that would accelerate, spread this protection. We are losing people who are not taking the second dose, so an effort needs to do how with the difficulty in access for registering, fighting fake news, and we think on focusing on these priority groups who should have taken the first or the second dose, which they didn't take. Active search, starting from the basic health units, or people who didn't take the second dose because they heard fake news from somewhere. So in face of the lack of vaccines that we are experiencing in our country, I think we need to have a very fast strategy to strengthen vaccination in some groups that once they receive the vaccine, they will have a greater impact on the population as a whole, to reduce the number of hospitalizations and all that. So this, for example, women who are breastfeeding should be incorporated into the program as fast as possible. This is happening in some cities and states, and the effort has to be very strong on actively searching for the groups who either did not receive, who should have been vaccinated and were not, either didn't receive any of the doses or didn't receive the second one. So this is what we have to do to take care of vaccine. So yes, Alexandre, thank you. We have two aspects there. When we talk about SUS, a lot of people who use private health systems think they don't use SUS. And this is a campaign that we have to work on all the time, because SUS is part of everybody's life in all areas, and everybody uses it. So we have to strengthen it. And then talking a little bit about vaccine, I'm keeping my eye on some questions of the audience. I'll ask you to give us 3 minutes answers, and I will have a question in that line for Luiza, talking about immunization, speeding up the vaccine program. I don't have the name of the person, but I would like to ask you about the purchasing of vaccines by the private sector. Would that help, or would that increase inequalities? I've been saying this since the beginning. There is no vaccine in the market. And those who sponsored vaccines, according to all the codes, the vaccine has to be for everybody. We need to have 75% of the people vaccinated. Next year, we'll have many vaccines. It's no use for me to vaccinate all the employees in my company if the families do not get their vaccination. We would need to vaccinate 40 million people per day. Since the beginning, our position is we're not buying and we are not selling vaccines, but we haven't been able to bring vaccines in. We will not leave somebody without a vaccine to give it to somebody else. As we won't do that until we have an excess of vaccines available. Next year, we'll probably have many vaccines available, and we'll be able to have them sold at private clinics and things like that. With our group, United for Vaccines, are together with the ministry trying to get and buy vaccine from outside. We haven't been able to do that. And if they manage to buy vaccines, the vaccines have been to be donated to SUS. It's no use vaccinating your employees if the family who's been riding the public transportation all the time is not vaccinated. This is something I've been saying since day one. It's no use buying. SUS has to be doing that. Next year, we'll probably have an excess of vaccines and everybody will be able to buy it, but not now. I have to say that I'm part of the group United for Vaccines, and I hear you saying that all the time. And then, okay, now moving to another question and talking a little bit about what Alexandre said, talking about the use of the structure by SUS, how can we make the federal government is to stop with the negationism of they have? Would our CPI be able to do that? I'll just finish this round because then we have to go to the closings. There's only one way. Brazilian institutions need to work. For example, we have a law that was created when I was the Minister of Health. It cannot be a decision made by the minister or by the government to have this or that incorporated into SUS, to spend money on this or that medicine. We cannot be linked to one government specifically. There's a law related to CONITEC, which is the Commission of Technology. The public government can only publicize, buy, and distribute or prescribe a medication that this National Commission of Technology has approved. We have doctors who are specialized, the visa is there. And so we have a law. The inspection situation are not used or they should work when you have a president who is performing actions that are illegal.
Let's just remind you that the investigation commission is not being backed up by the government. The installation of such committee was forced by a higher jurisdiction because according to the government, this shouldn't even be happening. So it is something that is there to be against any other thing that the other powers of the government are fighting for, something that is different from what the Commission is fighting for. The Commission is aiming at establishing what to do with the pandemics, and it is reaching more and more proofs that things went wrong. There are other ways that immunization should be tackled. There are other ways that medications in this sense should be tackled so that we could show the population that if a medication is pointed as the solution to the problem, the investigation committee can find out who decided that a medication was proposed, who actually pointed it first. And we are going to know and work on what obstacles are being created in the country, because this is a culture that works against life. We need to see what legal changes are going to have to be made so that we can challenge the government or any of the instances and organizations that are involved in this. We are going to create, as Professor Ester said, we are probably going to create a permanent counselor to give orientation on pandemics and other things that may put life at risk, and something that is going to be permanent. And this is an institutional debate, and this is of utmost important. We need to get ready for forthcoming pandemics. Unfortunately, this is going to happen, but we are going to have to be prepared for other pandemoniums that are going to show up. This is how we are going to improve the institutions. And this is what democracy is all about. It creates weight in our actions so that tragic moments like this one we are living do not happen again. I think it's of crucial importance, especially with the investigation commission. Yes, because if they repeat themselves, they are going to repeat themselves as strategy, because this is a strategy we are living now. So the role of communication and disclosure of information and conferences, just like this one we are in now, they are essential, because we are going to show people the importance on how to claim for clear communication in science. Because if we are not 70% of the population vaccinated, nothing is going to work. And this is being repeated during the investigation commission. The placebo medications are included in this discussion, and this false sensation of security. Because if us here working with communication, we debate this a lot, and there are some people from the Federal University of Alagoas. They have carried out a research that involves immunization. They are working with the University of São Carlos, and they are showing the challenge that is for Brazil having immunizations with 2 shots. Some populations, some people just do not understand that they have to show up again for the second dose, because we do not have a campaign that shows that to people. We can make a lot of noise on the internet, on Facebook, Twitter, and everything, but we know this is not going to reach everyone, because people need to be instructed about having to get back for the second shot. They are only going to be protected if they take both shots, and we need to tell them. So the role of science, the role of this communication is important. So moving forward and using this last thing that we've mentioned, the last question is to Dr. Ester. The question was sent by Isabella Vieira. What could Brazil learn from the experience from the other countries in regard to epidemiologic surveillance? I think Brazil has a lot to contribute. The unified health system has a lot from the English system. People who created SUS and created everything that SUS encompasses, they have been trained there, and it has a lot to do with their system. So I think it's an important system to be revisited. Let's see how their program developed, and probably we're going to learn from them. I think what they did there is much more expensive, probably more expensive than what we have here. So we need to guide efficient policies in regard to what track we are going to take. So I think that we have a great system. What we need to do is to look into it and see how can improve what we already have with our own tools. I think we have a lot to teach the world, but we need to empower ourselves and develop more technology ourselves so that we can improve our program that we have the same way we did when we had the HIV pandemics. Perfect, Professor. We are just about to close our panel. I would like to thank all of the debaters that are here now, and all the public, the audience who have sent a lot of great questions. I would like now to talk about the inequality in Brazil, and it is crucial for us to understand the impact of this pandemics. But as it has been said, it is a governmental role. We need to put pressure on it for it to work. Of course, there are protection networks and communication, but I would like to invite all of you, please get to know the initiatives we've mentioned, the observatory, the United by Vaccines, and other initiatives that are based on science, and get well informed. Because one of the problems that we have, and one of the lessons that we learned, how misinformation and massive miscommunication or decommunication, if so, is really disregarding the more than 500,000 deaths. If you have the chance to get immunized, go ahead, take your first shot, but don't forget, take your second shot, and then let's just move forward. Let's try to think on how to improve the coordination and Brazil's health, and also the scientific mindset and scientific disclosure. We've tackled all of these here today, so thank you very much, Alexandre, Luiza Helena, and Ester. Thank you very much, everyone from the Conférence Pour Le Brésil, and this is it. Thank you very much. Good evening, good afternoon, or good morning.